As we look at ways to bring the greatest amount of value to you and your family through the chiropractic care that we offer, there are different discussions and dialogues that we get involved in, but the reality is that there is one service that we offer that we believe offers you and your family the greatest value and the opportunity for the greatest amount of benefit long term for you and your family's health. And that's the concept of ongoing chiropractic care. And, I'm excited today to really talk about this because I understand all the conversations that happen in relationship to ongoing chiropractic care, meaning chiropractic maintenance or wellness care adjustments, care beyond just pain relief. And in many situations, this can be looked at as a sales pitch by the chiropractor to keep people coming back, or once you go to a chiropractor you always have to go, or it creates a dependency. And those are all discussions and dialogues that should be had and we're open to talk about, but we would like to reference those as it relates to literature and evidence, not just based on opinion and maybe somebody's dogmatic belief that has been perpetuated for a long period of time. And there has been what we consider to be some very good research articles published and that explain this concept in detail. One of the most important ones coming from Spine Journal, which we feel is one of the most respected spine journals that exist, and also it's not a chiropractic journal, so it's not like we can say there's chiropractic bias to this because it's a chiropractic journal. It's not, it's a medical journal. But essentially what they did in this article was they took people with chronic low back pain and they gave a group of them a sham adjustment, meaning that they kind of faked giving them an adjustment over a 1 month period. Then they took another group and they gave them an actual chiropractic adjustment over a 1 month time period. And then they took a third group and they gave them chiropractic adjustments over that 1 month time period. But then they continued to give them bi-weekly or twice a month or every other week adjustments for the next 10 months. And they looked at the outcomes and they found that, guess what? The people that got the fake or the sham adjustment, they didn't get any better. It didn't help them, okay? The patients that received chiropractic care in the second and third group both benefited from the care that was provided. However, the third group at 10 months out continued to show more improvement, meaning that ongoing care actually continued to help that person and improve their quality of life and well-being. And that's very powerful. It proves that, this is not something we're trying to do to sell you something. It's something we're doing because we put your best interest first and what is best for you first. And I think sometimes if we take this concept and move it into something else, we can help us get a greater sense of understanding. But the reality is if I go to the gym and you go to the gym and we both work out really hard for a month, okay? At the end of that month, we're both going to show some kind of benefit. But if I keep going to the gym for the next 10 months, once a week, and you completely discontinue going to the gym, and we look at who maintained the most benefit and who did the best, at the end of that year, we're going to look at it and say, you know what, the guy that kept going to the gym maintained his benefit longer. We could do the same thing with nutrition, right? We could both make sure we ate proper diets and lots of fruits and vegetables and ate at the proper times and got proper rest, and we could do those things for a month, and at the end of that month we could both sit there and say, boy, I feel better, I have more energy, or I'm sleeping better, or my focus is improved. But if you go back to the standard American diet and I continue on eating properly over the next 10 months, if we analyze that data and look at it at the end, who's going to be further ahead? Right? So it's not that, the reality is that we have to look at wellness chiropractic care in the context of what wellness care is designed to do, right? People that brush their teeth and floss their teeth and keep up with proper dental hygiene fare better than people that don't in the long run. So I think the concept makes sense, but I also understand the value that data provides and that we need data beyond my opinion or theory on the subject. Another study that I'd like to discuss with you was done, and it's very fascinating. They used patients that were all participants of an HMO, and they looked at 70,274 member months over a 7-year time period. So that's pretty extensive, right? Over 7 years, they looked at the members of this HMO. They looked at 70,274 member months. And these were members that used chiropractic as their primary care, right? And here's what they found. In comparison to the same geographical area, the same time period, when we compare this group of patients to under the same HMO, the same geographical area, the same time period of people managed under traditional medicine, here's what they found. The patients that were managed through a chiropractic primary care provider had 60.2% reduction in hospital admissions. They had 59% less hospital days. They had 62% less outpatient surgeries and procedures, and 85% less pharmaceutical costs. 85% less pharmaceutical costs. Does that mean everybody should go out and switch their primary care doctor or a chiropractor? I'm not saying that, nor am I suggesting that. What I'm saying is that we have published research from the Journal of Manipulative Physiological Therapeutics that says that managing our health conditions conservatively first through chiropractic adjustments, exercises, stretches, proper home management, nutrition, vitamins, supplements, in a complementary and alternative medicine way, that in the long run, it can save us 85% on pharmaceutical costs, 60% less hospital admissions. Those are huge numbers and important numbers for the longevity of you and your family, and reducing the burden of cost, inconvenience, and how it affects your quality of life. Doing the things that you love to do. This is all about you being able to perform and live your life to your greatest capacity. And that's what we want to do. So when we recommend wellness and maintenance care to you, it truly comes from our desire to offer you what is best for you. Whether you choose that or not is your decision. And we respect that your health is your decision and you're in control of those decisions. However, we I think it's our responsibility to offer you relevant information so that you can make the best decision for you and your family. Thanks for choosing our office. Thanks for choosing chiropractic care. Have a fabulous day.